Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwonitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Hey guys, welcome back to Between the Sheets. I have another sex therapist on here today, and I'm telling you, these are some of my favorite guests because they see sex from a different perspective than I do and have such great advice and tips on how to work through things. This is Dr. Jenn Kennedy. She is a clinical sexologist and licensed marriage and family therapist. She is based in Santa Barbara. She sees individuals and couples who are struggling with low sexual desire, dissatisfaction, and a whole plethora of other issues related to sex. Welcome, Dr. Jenn.
Hey, thanks. Good to be here.
Yeah, I'm so excited to have you here. So tell me a little bit about how you got into sex therapy versus all the other types of therapy. And where did that start for you?
Sure. Yeah. So I went later in life. I went kind of third career, actually. And I knew that when I went back to school to become a therapist, it was definitely for couples. Like that was my interest. And as I got kind of deeper into that work, I recognized that sex was something that a lot of therapists were really hesitant to talk about. Like we had very little coursework around it. And then as I started doing the work with couples, it was sort of this elephant in the room, right? It's like we're talking about their communication patterns. We're talking about their parenting. We're sort of talking around it, their coupleship, and over time, maybe how are they doing relationally? But it's like, what about sex? Nobody's talking about sex. And so I realized that there was this lack of information in the training, but there was definitely like this hunger for this information between the couples. And so I got initially like a 15-hour course that started that interest. And then I went and did the deeper dive into the sexology because I was like, people need this information. And it's been great. It's been really helpful to the couples work.
Yeah, that's awesome. It's, and that's why I started this podcast at work with urology. I get to do sexual medicine, but I also do general urology. And I just kept noticing how much there is a deficit in knowledge, in communication, and all of the aspects related to sex. And although sex isn't everything in our lives, it is a lot and it touches every aspect of our life. And so, yeah, hugely important. And you're right. There is just such a lack of not only knowledge and how to do things, but people like us who are willing to help guide you.
And I find that when sex isn't happening, or there's avoidance around it, or there's shame, or there's pain, or there's, it becomes this other thing that is happening for people, that is a preoccupation or embarrassment, or, it creates a whole bunch of energy that isn't necessary. And so if they can sort it out, it's going to go better.
Yeah.
Even though we're not having that much sex, especially in longer term relationships, if it's something that feels like it can't happen, it creates a big problem.
Yeah. Yeah. Do you tend to work with individuals or couples, or do you do both?
Both.
Okay.
Yeah,
Excellent.
definitely both. A lot of couples, but also I get individuals too who are having low drive or low satisfaction or pain or discomfort or problematic histories with sex and sexuality or compulsivity. Like I kind of run the whole gamut of issues around intimacy and sex with men and women.
Yeah. Okay. So I know one of the things that you mentioned that you work on is, with the individuals and their own needs, that anxiety can be a big factor in your sex life. How does that look for your patients, and how do you help them start peeling back those layers?
Yeah, anxiety is huge for this realm because once something doesn't work, it starts to creep in as this like possibility that freaks people out. And they just sort of have this anticipatory worry that it's going to happen again. And that could be, I don't know what I'm doing. It didn't work. I'm not a very good lover. I don't have skill. It could also be my body didn't respond the way I wanted it to. My body doesn't look the way I wanted to. It comes in a lot of different forms, but anxiety is, I would say, the number one problem with sexual satisfaction.
Yeah.
And it happens for both men and women. It happens
Mhm.
for young people. It happens for older people. It happens in long term relationships too, even
Mhm.
with partners that you've been with for a while. You can psych yourself out, and then it just starts to sort of be this thing that causes a lot of avoidance where it's like, I feel like this isn't going to go well, or I did something that it was embarrassing, and it just starts to erode at the self esteem or the
Mhm.
confidence. And so plenty of people just avoid sex altogether,
Yeah.
or they go back to the same exact thing because they feel like that might be a way to avoid basically embarrassing or shameful
Yeah.
experiences.
I know one thing that I'll see in patients, a lot of my guys that deal with erection issues, that
Yeah.
brings them a lot of shame and it brings them anxiety about their performance and their ability to get an erection, to maintain the erection. And
Yeah.
then because they're anxious, they're even further down the spout of not being able to get an erection or maintain an erection because the mind connection, I always tell my guys, it's your head to head connection
Mhm.
that it's so strong and it's so connected that if you're frustrated or anxious or something up here, your genitals respond to that
Yep.
and you're not going to reach climax. You maybe won't get your erection or your fully engorged clit or whatever along those lines. And it's definitely not going to be satisfying.
Yeah. Yeah. And it's like you can't will yourself to follow through in these moments. If
Yeah.
you think about, like, we all know when we've been really nervous for like a test or something, and you get
Hmm.
like a stomach ache, and it's like you can't make yourself not have that. I mean, if you are trained, eventually you can breathe through it,
Yeah.
and there's ways of relaxing the system. But same thing goes, like if you're heading into a sexual experience and there's a ton of your body is flooded with anxiety and chemicals, good luck keeping that erection. You can't overpower it. There's physiological things that are happening because it is not a priority in your body's fear state to keep an
Yeah.
erection. Your body has
Right.
other things. It has things to fight or to run from. It
Right.
doesn't need to, like, in that moment, have sex.
Yeah. How do you kind of help calm people down and help them regulate themselves so they can work through that anxiety and get to satisfaction and pleasure?
Yeah. So first we have to understand sort of what is the thought process that gets you there. What
Mhm.
are the self-defeating thoughts that tend to come in? Because if you walk that back, that's good information. Is it, is, like I said some of the things before, is it like I hate my body? Is it that I'm afraid that I'm gonna, there's usually some sort of failure expectation that's running through their mind. And so if they put all this pressure on themselves, then how can they like engage their partner to
Mm.
participate in the exchange to have it go differently? Right? If there's
Yeah.
a little bit of lightness, if there's some humor, if there's some discussion, if there's some touching that is
Mhm.
building up the pleasure, then it's not just like you are on stage and performing. Because a lot of times that's how guys feel, right? It's like
Yeah.
you got one shot, you got to walk in, you got to go into this and make this magical experience where you're
Mhm.
expected to mount and perform. And it's like,
Yes.
that is too much pressure,
Yeah.
right? It's like, but if it can be this exchange back and forth where your body is getting a feedback loop of like, oh, I like this, this is working, this feels good, where the partner is touching them and giving them signals of like, I'm enjoying this, I want more of this, position me here, and
Mhm.
there's signals, then their mind body is going to keep saying, oh, go forward, this is working. But if they're really up in their mind and they're not actually paying attention to partner, they're not going to get that, and they're going to psych
Yeah.
themselves out. And so, yes, part of it is self-regulation, but a big part of it is the co-regulation that can be occurring with their partner.
Mm.
And so if they can stay attuned, and ideally if their partner is kind enough and aware enough that they can do that with them, then great. It's interesting because some people can do this. They can do it kind of on their own. They can do it with or
Mhm.
without a partner. They can do it in like a sexual experience where they don't even know the person very well.
Mhm.
because they're just so turned on that it kind of overrides everything. So sometimes people are able to have more casual sex really easily when they have more investment in a partner and more is on the line,
Uh,
they psych themselves out. So it kind of
that
varies
makes
depending
sense.
on the circumstance and what story they're telling themselves.
Yeah.
So part of it is though, if they can get that feedback loop, then it helps because even in circumstances where a man loses his erection, what I typically encourage them to do is don't like have that be like cut and leave. Just keep going
Yep.
because you still have sensation. It still feels really good.
Yep.
Just keep going with whatever's happening. And likely, if you don't freak yourself out and tell yourself a story, it may very well come back.
Mhm.
If there's enough sexually relevant information happening between the two of you and it
Yeah.
feels good, it may very well come back. But
Yeah,
if you're flooding
and even
yourself
if it doesn't come
oh,
back, you may still achieve the orgasm because men don't have to be fully erect to get their orgasm.
yeah.
Yeah. Do you think that I'm a big fan of scheduled sex. I think a lot of us put off sex because it just doesn't fit into our schedule. We forget about it. We're too tired, whatever. So I'm a
Yeah.
big fan of scheduled sex. How does that work with anxiety? Does that help because you
Mhm.
can kind of prepare yourself throughout the day? Or does it hinder because they're freaking out all day until the event?
It can go either way.
Okay.
I think for the planner type, it's really helpful because
Mm,
then they're not surprised. Like I see this sometimes where it's like, well, I need to be clean or I need to have I can't have competing priorities at the same
mhm.
time. So for that person, they know it's coming. They don't have too full of a stomach, whatever. All the
Yeah.
things that get in the way that
Yeah.
freak them out. I know there's a lot of partners that really like the schedule. It also takes it out of anyone's responsibility to initiate because
Mhm.
then it's just on the schedule. It sort of neutralizes it,
Yeah.
if that makes sense. For those that really like spontaneous sex, it feels less spontaneous, although it can still be how you have sex is still
Mhm.
spontaneous. It's just sort of a time that's carved out. That's my argument for that. It's yes, the time is on there, but it's just more like you've just allotted this time to be intimate. How you
Mhm.
do it is still up for grabs. But I think it's quite helpful. I've done this with plenty of clients where I say, hey, just set aside this time where maybe you're just gonna be touching or maybe you're just gonna be playful in some way. Maybe you're gonna do a card game. Maybe you just definitely know you're gonna have intercourse. Like that's
Mhm.
who they are. Some people will do sensate focus. I sometimes assign that as just like a really basic thing to kind of warm them up, but there's some intentionality of intimacy. So
Mhm.
I like it because it builds in continuity, right? So there's
Yeah.
some regularity. And I think that's helpful for those
Yeah.
folks that really want to deepen their relationship and have more consistency.
Yeah, I think so too. And in my world where work with men and women who have medical issues that
Mhm.
affect their performance, scheduling it helps. They can take their erection medicine ahead of time. They can use their lubrication. They can use their vaginal creams, whatever it might be that helps prepare them for that event as well. So I think depending on the phase of life that you're in, whether it's, okay, we can get a babysitter so we can have that time, or it's later in life and you need your Viagra beforehand, or whatever it might be. I think that there's a lot of pros to it. And I think, it's one thing people who don't have maybe intimacy issues in their relationship don't realize how great scheduled sex could be because they are very good at being spontaneous. But people who all of a sudden it's been 2 weeks since they had sex because they don't make it necessarily a priority and they don't even realize it's been 2 weeks because their schedules have just been so chaotic, so busy, so misaligned, or one was in the mood at night, one was in the mood in the morning, and it just hasn't lined up. I think scheduling it just really helps maintain, like you said, that consistency within the connection.
Yeah. And they get the payoff. They get the payoff of it happened. They connected. And then they're like, that was so nice,
Yeah.
right? And it's like, who cares if it was scheduled? I mean,
Right.
you had scheduled sex in the way of setting up dates when you first started seeing somebody, right?
Yeah.
It was sort of like implied that you were going to probably hook up at the
Yeah.
end. So I think it totally works. I think
Yeah.
it's
I
it's a great
agree.
solution for many couples.
Yeah. One of the other things that I was reading about on your platform is introducing sex toys
Mhm.
and how if that hasn't been something that you guys have done since the beginning of your relationship, it can be kind of intimidating to bring up to your partner that
Mhm.
you want to try bringing something else into the bedroom. How do you help people work through that anxiety and that conversation and get the benefits out of these toys?
Yeah, it's funny. I feel like there's like an age delineation with toys. Like the younger set are definitely, they've been raised with it, they're more comfortable with it. Whereas like I'd say over 50 set are a little more, there's a little more hesitation,
Hmm.
trepidation. There are so many different toys that can be really great enhancers. And it doesn't compete. Actually, is just like this fun third thing that can, introduce. And
Hmm.
I'm talking about everything from like a blindfold, right? That just sort of
Hmm.
like limits some sensory handcuffs or even like, restraints of any kind,
Hmm.
as well as like, of course, vibration, penetration, anything like that. If the goal, which hopefully it is pleasure, then it enhances and it is just an assist.
Yeah.
And hopefully nobody's ego is getting like bruised in this process
Hmm.
because it's not, we're not all built the same. If you had
Hmm.
great sex earlier in your relationship, or even if you had great sex with a different partner, that doesn't mean that you can plug and play with this person. Each person is different. And
Hmm.
so if you want to have better sex with this person, then toys are sometimes a way to make that happen. And so is lube. Lube is really
Yes.
helpful. And so just having that experience together where you can go and look through and say what might be fun. And
Hmm.
sometimes pressure or restraint or vibration can be really, really nice. It's just a sensory element that
Yeah.
introduces something different. It's also fun just collectively that you can try that thing.
Yeah.
So
I
I
love that
strongly
you
encourage
call
it.
I love that you call them enhancers because that really is how I look at it too. It's
Mhm.
not replacing anything, it's just enhancing your session, and it
Yeah.
doesn't have to be something that you use every session. It could be every once in a while.
Yeah.
And the other thing when you said vibrations, so there are so many actual medical benefits to vibrations as well. It increases blood flow. It can help men have better erections. It can have women have better stimulation and orgasms, deeper, more intense orgasms. So, and it doesn't have to be
Yeah.
a vibrating dildo. It could be a vibrating cock ring. It could be just a vibrating apparatus that you put on your finger and just touch in different places, maybe even to the nipples, not even the genitals. There's so many different things. I love vibration for so many aspects. Men can use it. There's some out there that go underneath like their taint area and
Mhm.
can vibrate and put pressure on their prostate, which is a
Mhm.
really great sex organ for men's enjoyment. And for women, you can use them externally, internally, anally while you're being vaginally penetrated or vaginally while you're being anally penetrated. There's a lot of different ways to use them. So I'm a huge proponent of it
I
myself.
mean,
And I
I feel
think,
like even just like a feather or like an ice cube, like if people are
yes.
really, really starting out at basics, it's just like
Yep.
just a little bit of like there's wax that you can, drip
Hmm.
on the skin. Like if they're not comfortable with inserting anything, like start basic, right? Because
Yeah.
anything sensory, anything new makes the brain wake up a little bit and go, "Ooh, wow, that was a
Yes.
little naughty. That was kind of fun," but it can really make the experience better.
Yeah, we call them pervertibles. So go through your house and find something. So you don't even have to go to the store and buy anything. Find something, a fork, a pizza, like anything that can be something different to give you
Yeah,
different temperatures, textures, sensations, things like that and incorporate them, I think it can be really fun. So maybe the two of you say, all right, we're each going to find two pervertibles through the house and we're going to come together and see what kind of
oh
sensations
my
we
god,
can
I
have tonight. Like, I think it's such a fun idea. And you're right. It doesn't have to be anything like
Mhm.
crazy or intense. You don't even have to go to adamandeve.com if you don't want to. Like, you could,
Yeah,
Amazon has stuff too. But yeah, you can just find things around the house to get variations in sensory or shoot, even just have sex in a different room of the house. How
yeah.
many sensory changes that can bring. Yes. Yes, absolutely. Absolutely. So, talk to me about some of the big issues or the most common issues that your couples are coming in with. We've talked a little bit about mismatched libidos. What are some of the other themes that come up a lot for you?
Yeah, typically the mismatched desire is coming in where one person feels higher drive than the other, although typically they're actually not that far away from each other as it seems. And one person gets labeled as such and the other person's labeled low and one's labeled high. when really they're actually both probably fairly normal. I also see a lot of women that are around the menopause age and they are taking a serious dip. Typically their libido is dipping. But what I will also say is that right now in this time period, those women are typically around 50. And I
Mhm.
feel like there's a correlative with they have historically not always had the best sex life.
Mm.
And so it's not just that their bodies are having hormonal shifts, it's also that they historically haven't always had the best payoff in their relationship and their marriages are hitting this place where their kids are going off, if they had kids, going off to college, and they're sort of reflecting and renegotiating, do I want to stay in this relationship? Do I want to keep having sex with this person? And so it's this interesting thing of it gets presented as low desire, but it's not, it's also a relational renegotiation
Mhm.
of there's some foundational relationship stuff at play too. And so it comes out in the bedroom, but it's actually like we have some problems around respect, communication, mutuality, and that type of thing that we need to resolve as well. Because it's hard to
Mm.
desire somebody that you don't respect. And if you're
Yeah.
carrying resentment, it's like, I mean, you still can have sex with that person, but oftentimes you don't want to,
Mhm.
you know? So it's interesting. Like
Yeah.
desire is up here so much
Mhm.
when you're older, especially, like, right, when you're
Yeah.
young, you kinda can just want it, but as you get older, it makes sense, like, what's happening up here, and so
Mhm.
relationally, we have to iron out some of that stuff for it to physically and emotionally connect.
Yeah,
So
that's interesting. I like that perspective. Yeah, and a lot of the women, like you said, are dealing with hormonal shifts. And we had a great breakthrough recently for the estrogen therapy, which is fabulous. And I'm a huge proponent of vaginal estrogen for women. Makes a big difference. But sometimes women also don't realize that their testosterone does take a dip. And some of us need testosterone replacement for that desire as well. And so it's really important, I think, for women to realize that there are multiple factors coming in here. You've got the resentment or the decrease in, desire because of other effects in your relationship, but there
mm,
are also the medical ones that maybe we can help you with. And
yeah.
then I'll send them to you and you can help them deal with the emotional and mental aspects.
It's tricky because we are it's sometimes things are blocking other things. Like I
Mhm.
always look at, we look at the biopsycho interpersonal
Yep.
things. It's the biological is the medical, right?
Mhm.
Are we looking at hormones? Are we looking at depression? Are we, that's somewhat the psychological, but what's all happening on the biological side?
Yep.
What's happening in the psychological realm? In terms
Mhm.
of is there grief? Is there depression? Is there PTSD? Is there,
Mhm.
anything like that happening? And then interpersonal, what's happening between them and another partner? Is this
Mhm.
partner specific? Is there trust issue? Are there trust issues? Is there, satisfaction issues, that type of thing? And so
Mhm.
I can't just take it at face value. I kind of have to be seeing the whole picture. And sometimes I need to give them a medical referral.
Yep.
And sometimes I have to give them a referral to an individual therapist to go sort out that stuff, because it's like I
Mhm.
can't I can't quite see
Yeah.
what's happening.
Yeah, it's very true. So I'm on the opposite side of it. They come into me because they can't get erections. They have pain with sex. They're not lubricating them well enough themselves anymore, things like that. And I help fix the medical part of it. All right, follow up with me in a couple of months. And they're like, well, like I feel better, but like I still don't want to have sex or I can't get that orgasm. I can't, I only want it every few weeks or something like that. But it's not the medical aspect anymore. I've checked your testosterone. I've got you your ED medicine. I've got you on, pelvic floor physical therapy or whatever it is that I'm doing for the individual. And then I get my sex therapist on board and I'm like, I need help with this because I fix the medical part, but there's more going on here. There are so many layers to
Mhm.
having quality sex. And it's multifactorial. It is the emotional and the medical and the interpersonal, like you're saying. I mean, that just hits the nail on the head right there.
And also, I mean, at the base of this, we're animals. Like,
Mm.
sex isn't, I mean, yes, sex is necessary for reproduction, but after you're past that reproduction age, or even like, I'd say once you get into your late 30s, early 40s, and other stuff is going on, you don't need to have sex in
Mm.
the same way. And so you have all these competing priorities in the way of work, career, friends,
Mm.
family, finances, all these other things. And so it's like, sometimes people come in expecting that they should just have this sex drive, that they should
Mhm.
drive, that it should just be there, and that
Yeah.
they're comparing themselves to earlier functioning,
Mhm.
their 15 or 20 or 25-year-old self. and what's normal,
Yeah.
what's normal, it really depends on what are the other factors that are impacting your life, and also what's your general functioning, previous functioning, but what's your general temperament, you know?
Yeah. Yeah, most people aren't having sex 3 times a day in their 40s and 50s.
No. Or 3 times a week, I would
Right.
say. They're not even having it
Right.
3 times a week. They're
Yeah.
lucky to be
Yeah.
having it 3 times a month, you know?
Yeah. It's amazing to me, kind of coming from a cultural aspect prior to getting into sex med that, first of all, you think men have the higher sex drive because that's what we're taught. And
Mhm.
that's not necessarily true. I know plenty of women who have a higher sex drive. Research shows women have the same, if not higher sex drive. You see that people have sex every night before they go to bed in the movies and the shows, and that's kind of what the expectation is. And that you're with this partner for your entire life and it's just always amazing and you always want each other. And then you get actually into this realm of world and you're like, well, that's just all horse shit. That's not real at all.
So, yes,
Yeah.
absolutely.
Yeah. It's so
Because
interesting.
again, there's all these pieces at play, and
Mm,
if the higher desire partner, if there's someone that's initiating, there's usually, like, the other person might be more neutral and like, "All right, like, let's okay," because there's this sort of, especially in a heterosexual couple, if the man is initiating, the woman typically takes a little bit more warm up, but
mhm,
she's starting at like neutral to negative, and then it's like, okay, if he can stay with it, then she's going to maybe shift into like okay, and if she can lubricate, then she might go to yes. But there's also a feedback loop, and if there's pain, or if there's
mhm,
resentment, or if there's fatigue, or if there's an early PTA meeting, or if there's an early board
yeah.
meeting, or whatever, or if there's a million other things, then she might say
Yeah.
no. And if she says no too many times, he might not ask anymore. And so, there's a lot of relational dynamics
Yeah.
as well as physical dynamics that are at play, and logistical dynamics. So people have to decide why.
Mm,
Why do you want to have sex? Are you having sex because you should? Are you having sex because there is a emotional or relational or physical payoff? Like that's a question
yeah.
I often ask in the beginning, like what is the function of sex for you?
Hmm.
You know? What is your why? Because if you have a really good why, then we might find a how easier.
Okay. That's really interesting. Yeah. So the why, the connection, the intimacy, or is it just because, like you said, like I should want this, I should do this because this is what I've been taught that society says that married couples or couples in a relationship should have sex 3 times a week or whatever.
Yeah, some people get really freaked out that if they're not having sex, that their
Hmm.
partner's going to cheat, or that
Mm,
there's something wrong with them, because they're comparing themselves to other couples, or it's not really
hmm.
organically because they care
Yeah.
about their own needs. Like they don't want it more. They just don't
Hmm.
want to not have it and have it be a symptom of what could be perceived as
Sure.
a problematic thing. That's
So
a
how do
hard
you kind of
sell.
Yeah, for sure. How do you help the patients work through this? Like, if they have this idea that they should be having sex this much, they're not. So they kind of feel like failures, but they love their partner. They don't, there's nothing wrong, like in that regards. How do they get that intimacy back?
So, okay, well, what I just described, if they want it, a lot of times
Mm,
my couples come in and they want it,
mm,
or
yeah,
one of them wants to want it, and one of them actually does want it.
got it.
So that's the ambivalence that can be tricky, right?
Mm-hmm.
Because it's like I want my partner to be happy, but I could kind of take it or leave it. So, but if you extrapolate that to like the larger context of relationships, we experience this in plenty of ways, right?
Mm-hmm.
Like I don't really want to watch this show. I don't really want to go to that place on vacation. I don't know, there's lots of ways we make compromises in relationships. And
Mm-hmm.
so it's like, or you feel like I could take it or leave it, or I could do it this way or that way. Engagement in intimacy having intimacy, I think, is really important in relationships.
Mm-hmm.
Having sex is debatable. I
Yeah.
think closeness is really key. I think having penetrative sex per se, not critical.
Yeah.
I'm gonna
I
I'm
would
gonna say
agree
it
with
that
that,
way.
and I think that there are times where I actually tell my patients, like, "Stop worrying about penetrating. Stop worrying about whether or not you have the erection. Stop worrying about whether or not you get the orgasm. Just feel the pleasure. What
Yeah.
feels good, what doesn't, and enjoy that." And if the orgasm comes, if the penetration comes, fine. Maybe you guys decide to do that. But just bringing it back to pleasure focused,
Yeah,
I think is really important.
I agree. I think that it's a reframe of
Mhm.
what are your goals here? Because if the couple can agree on that as a goal, as the closeness, because oftentimes the high desire partner, when we really look at what they're seeking, it's attention. It's not
Mhm.
sex because sex is over so fast,
Yeah.
right? It's like an orgasm feels good, but they can give themselves an orgasm for the most
Mhm.
part, right? I mean, it's not that hard to masturbate. So, what they're really seeking is attention, oftentimes, or validation, or
Mhm.
closeness, or an experience of an exchange that can be achieved in a relational dynamic that
Mhm.
might look like a different configuration. So, I'm
Yes.
trying to facilitate, are there ways to have you guys be in relationship in a meaningful way that
Mhm.
maybe looks different than sex sometimes? And when that is happening more frequently, when they are more naturally doing that, sex tends to happen as an outgrowth of it pretty organically,
Mm.
but not always, but often
Yeah.
it does. That's
Yeah.
what I find. But it's
That's
like if the
amazing.
focus is just like, how many times are we having sex? It's like,
Mhm.
oh my gosh, then again it becomes this pressure, this kind of pressure
Yeah.
point. Mhm.
Do you find that that is the definition of what people are looking for when they come to you and they say that they're having sex and intimacy issues? That it's a mismatch of how often they want and or have penetrative sex?
Mostly.
Yeah.
It there's nuances to it and it can look different. Sometimes, again, it's the quality of the sex. Sometimes but oftentimes it's the frequency. It's the
Yeah.
frequency or they've just stopped altogether. And
Mhm.
and one person is feeling like they're guarding, they're guarding their body and the other person
Yeah.
is like hands in the air, doesn't know what to do.
Yeah.
And so they're at an impasse.
Yeah. What other forms of intimacy do you try and get them to explore? Massage, talking, different looking or touching, or what else do you try and get them to explore?
Yeah, I mean, intimacy is like it's like that old quote about porn, like you know it when
Mhm.
you see it, you know it and you feel it, right? It's like when you really trust each other and when you're close and when your mirroring neurons are going off. It's like it feels so good. It's like when you're laughing together, when you're in a shared experience of whatever activity. I try to get them to go back to when they really enjoyed each other's company.
Mm.
What are you doing? And couples have their own language and they have their own interests, but
Mhm.
typically they have shared meaning of whatever sort, right? So I'm not
Mhm.
going to say it's this one thing and it doesn't have to involve touch. But typically, there's some couples that are highly intellectual and they like talking about
Mhm.
important things. There's some couples that are quite physical and they enjoy sports. There's some couples that are very philanthropic and they enjoy those types of, doing more of those types of giving type, events and
Activities.
stuff. Yeah, so it kind of depends on like what matters to you as humans and
Mhm.
collectively, where do you vision together? Where do you
Mm.
move through the world in ways that matter to you both? And then how can you show up collectively? Um, and where do you light up and witness each other lighting up? Because that's
Mm.
where you find each other again, right?
Yeah, I love that perspective. That's really neat. So, yeah, where you guys light each other up and individually and as a couple, like you
Mhm,
said, because I know when I talk to whether it's friends or my boyfriend or whatever, when someone's passionate about something,
mhm,
the way that they talk, the way their excitement is so much more exciting than when you have them talk about something they're not passionate about. And so
mhm.
I can visualize what you're saying about find that passion, that light of whatever it is outside of the bedroom and then, that reconnection and that intimacy that builds can then in turn lead to more intimacy in the bedroom.
Yeah, it's like when you're watching your person do their thing, but also when you're collectively doing something meaningful, as a unit,
Mhm.
I just think it changes the energy. It inherently draws you back towards one another organically. So it doesn't feel like I
Yeah.
have to. It feels like I get to be with and near this person. Right. So it's seeing the disconnection. It's making a conscious bid towards reconnection, but then it's
Mm.
allowance for kind of what results.
Yeah, that's amazing. I love that idea. It's
Yeah.
and it's so simple. That's
Mhm.
the best part about it. It's just so simple. What did you used to do that you loved doing together and what can you do now to reinvigorate that? That's similar to that.
It is simple, but it's also unique to the couple.
Yes.
Yeah.
Yeah. Well, yeah, because I'm not going to go play basketball and feel really intimate with someone.
No.
That's not for me. But I can hear you. I can see that that might work for somebody, but it's not going to work for me.
Yeah. Yeah.
No, that's great. I love that tip. Do you have any other like major themes or take home points that you want the listeners to hear today?
So, I mean, that framework I just sort of named is something I'm working on, that, kind of that disconnection, reconnection, and then allowance is something I definitely put through with the couples that I see. And I just, because I so committed to like the intimacy being and pleasure specifically being the
Mhm.
goal versus sex. I'm a sex therapist, but sex isn't about sex therapy, and sex in general are about intimacy. They're about closeness
Yes.
in my
Mhm.
experience. And I think that's where most people really want to get.
Yeah, and I think the pleasure part of it, I mean, I think one of the disadvantages of the way that our society and culture has been for so many years is that sex is glorified as just this like quick functional part of a relationship or is just for procreation, and it's doesn't really focus on how much pleasure you can get out of it. How much pleasure not only you can feel from your own orgasms, but how much pleasure you can get from giving your partner pleasure, and how amazing that is to create that connection where your partner's needs are higher than your own because you're so focused on making them feel good. And then they hopefully in turn also do that for
Yeah.
you. But it is such an amazing thing to change the focus from just, let's get this orgasm, let's do it because we're supposed to, because we're in a relationship and the society says we're supposed to let's find intimacy, connection, and pleasure.
Yeah.
And whether that involves full on penetrative sex or not is a moot point. You just focus on pleasure and intimacy and connection. And I think that is such an amazing focus versus society tells us we better have sex.
Yep. I agree.
Yeah. Yeah. Awesome. I really appreciate your conversation today. This has been amazing. Tell everybody how they can get in touch with you and follow you.
Sure. You can find me at Dr. Jenn Kennedy. That would be on Instagram, and pleasureproject.us is my website. So that
Okay.
has my podcast and my course, which has come out. And it's specifically geared towards women. I mean, it
Okay.
is definitely beneficial for couples too, but it is a robust course. It's a curriculum that is geared towards women who are having challenges with intimacy. And
Mm,
it has 6 modules that are all about the stuff we're talking about. It's looking
okay.
historically about challenges. It's a lot of information that is really helpful foundationally. And then it's looking forward. It talks about sex toys. It talks about attachment. It talks about just really understanding sort of what is your style in, all of this, and kind of like where you're going and where you want to be erotically. So that is on there. And if you use discount code, which I'll send to you as well, but it's
Sure.
FALL,
Okay.
FALL, that'll get you a big discount, 60% off. So
Awesome. All right.
yeah, I
I'll
just
put that
created
in the
that.
show notes along with the links to find you. Thank you so much, Dr. Jen. This was an awesome conversation. I appreciate all of your knowledge and expertise.
Yeah, great speaking with you.
Awesome. All right, everybody, go have a great week and go have some fun between the sheets. Thank you for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening and go have some fun between the sheets.